So what we're seeing is Dr. Jennifer Campbell sedate Romeo in order to float his teeth. And that's...
So we're trying to see if we have a side-to-side lateral excursion, and he doesn't really want to, part of it he's fighting me, part of it he is getting caught, so his points are catching, and he doesn't have a very good side-to-side motion, which is what they need to eat well.
So Jen, you just use a tranquilizer for him?
Yep, and a little bit of a pain reliever too. So a little combination of democidine, and which is ditropamine, and butorphanol.
And how long is that effective for?
Typically about a half hour to 45 minutes, depending on the horse. Some horses process it faster than others, and some horses will try to kind of go through it very quickly, and some horses will take a while to use it up.
And next to Romeo, you're seeing Tracy, who takes care of him. He's my trainer, and also his nurse at times. Right, Trace?
Yep.
And my trail riding buddy.
Yeah.
So, unlike you guys, when you come, well, we have 7 other horses online today to get their teeth cleaned and floated, and they're all in a rush to come in.
So we're starting to get a little sleepy here. You can look at his eyes. And just kind of coming up along the side, I can feel just some sharp edges in his teeth. And you can see horses have quite a few teeth back there. It's kind of hard for you guys to see it on the camera, but he's got some food and hay that's he's kind of saving for later, which we'll have to get all that out. His teeth aren't too bad.
My patient's biting me. He's not biting you?
He's still a little sleepy, but he's trying. The thing is I have his tongue, so if he goes to bite, he's going to bite his tongue before he bites me. It's a good little trick. You can tell he hasn't been brushing. He's got a little tartar and plaque buildup.
Can he have his teeth whitened today?
Sure. That'll be extra.
He's a show horse, isn't he?
Of course.
We show him in the barn. That's about all that's what we show him. We show him to the trails, too. You can see his head dropping.
So we're just going to flush out and try to get some of that food that he's saving for later. We'll flush that out.
Now, don't you think he should rinse the Listerine?
It's a bluish color. You can see little pieces of hay coming out that he's hiding up in there.
Now, does he actually hide it up there, or just gets stuck
It
up
gets
there?
stuck, so especially when they get sharp points, as they chew side to side, they don't always go all the way side to side, so they get higher points on the outside by the cheek on the top,
Right.
and on the bottom by the tongue. So, and then as they can't go side to side as much, they pack up food up in the corners. So usually on both cheeks. And you'll see, most people think that this is the only teeth that horses have, but however they go all the way back to here, and there are teeth all the way back.
How many teeth do horses actually have? Do we number them?
We do number them. We have, you can see we have 6 on each bottom, or 6 on top and bottom in the front. And then we have the canines, which are not in all horses. So you can have top and bottom canines, but they're more common in the males. And then the wolf teeth are also kind of optional. Sometimes we see them, sometimes we don't. And then we have the that the wolf teeth would be the first premolar. Then we have another 3 premolars on either side, and then the molars. So,
In total, how many teeth does it have?
depending, you'd have to count it up.
120? Sounds like a lot, doesn't it?
It is quite a bit, and I can let you zoom in here in a minute and you can get a better.
Do you mind if I hold her in there? No, that'd be good.
So what I'm going to do before I put the speculum in, I'm going to just start and start to file down some of those sharp edges. So what these are carbide blades. They only kind of shave off in one direction. So we get a flow going and it'll shave off. This one's shaving on the pull, so when you pull back, it shaves off those sharp edges on the enamel. And you can see he's getting a little sleepy now.
Yeah, his head's dropping, isn't it? Soon he'll be on the floor. He'll be licking concrete.
I was gonna wake him up.
See, he's still awake enough to kind of wiggle his mouth a little bit there. And a lot of it too we can do by sound. We can hear the sound that it's making and know that we're actually doing something. And he's biting down on my foot a little bit. So you can see this white is the part of the enamel that's coming off of the sharp edges.
What are they doing to me, Mom?
Alright, so this is the speculum. It's a full mouth speculum. And what I'm going to do is I'm going to take this collar off and just put it around his neck. So in case we need to grab onto him. Okay, so his mouth fits in these 2 plates. And then once we get everything adjusted just right, we can open up his mouth and get a good look in there. And that way we can get our fingers in there without risk of getting them bit off.
Always reminds me of headgear for orthodontics.
It's very similar. Alright.
Except they wear that for a long time.
We'll go side to side so we don't open up one side more than the other.